Hello and good afternoon to all of you. I extend a warm welcome to all participants of this webinar. I am Dr. Manu Uday Kumar. I am an oncologist and the medical director at Merago. Merago is a patient-centric digital healthcare service company with a mission to deliver affordable health management and access to care. I'll be moderating today's session on school healthcare. This webinar is part of Merago's webinar series in the domain of student well-being. We had conducted a webinar last month. For those who have attended it, you will recall, on mental health awareness. These recordings are available for your offline browsing on YouTube. Please have a look. Schools and its management have a responsibility of creating awareness about preventive healthcare, and this should be ideally a part of health promotion for comprehensive school health programs. Today's program, by any stretch of imagination, is not designed to teach you about childhood diseases at all. On the contrary, the focus will be on how to sensitize, make aware, help in disseminating knowledge on preventive health and early detection of both physical and mental health of your students. I have great pleasure to introduce Dr. Amit Vasist. He is a medical officer at Merago. He will deliver his webinar today on the topic Promoting Healthcare in Schools. I hope you find it informative and that it will help you in establishing a very robust health program for your school. Please type in your questions during the talk in the chat window or at the end of the talk, and I will take up all your questions and have a meaningful discussion after the webinar is over. Thank you to all of you participants for signing in for this webinar. I will now hand over the stage to Amit, who will deliver the webinar. Dr. Amit, over to you.
Good afternoon, everyone. Thank you, Dr. Uday, for the gracious introduction. Before we begin, I want to remind everyone that this is a space for ideas to be shared, challenged, and refined. No question is insignificant, no perspective is irrelevant. We are all here because we believe in the power of learning and its potential to transform us in profound ways. So please feel free to post your questions in the chat box. Those will be addressed at the end of the session. Promoting healthcare in schools and the tagline being healthy children make better students. It's quite an interesting topic, right? We are all aware that child health and well-being is an extremely important issue for parents. But you know that schools could have a great impact too. So first, let's understand the definition of health. What is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's great. But what is the significance of health in a school setting, you may ask? Schools have an extremely important role to play here. By addressing the student health concerns early and by providing necessary support, they contribute to reducing absenteeism, promote academic success, and importantly, nurture overall student development. The significance of healthcare in schools extends beyond individual students, playing a crucial role in building healthier communities and preparing future generations for a productive and fulfilling life. So what's the impact of health on student performance and overall well-being? So the impact on health on academic performance, as you all know, is undeniable, as good physical and mental health directly correlate with improved concentration, cognitive abilities, and information processing, leading to overall academic enhancements. By embracing their role as school health promoters, school can contribute to overall development and success of students, cultivating a positive atmosphere that enhances learning, resilience, and lifelong well-being. So these are the key health areas in schools, which I think need to be addressed and need to be looked in deeper. So they include physical health and wellness, mental health and emotional well-being, nutrition and healthy eating, first aid and emergency preparedness, vaccination program and infectious disease prevention, health education and promotion. So we'll be dealing with each of these one by one. Physical health and wellness. As I'm sure all schools have a proper P or PT class, which is either once or twice a week. And physical activity, as you all know, is extremely vital for student health as it offers numerous benefits, which include improved cardiovascular fitness, muscular strength, improved bone density, and it enhances the overall physical well-being. So what can schools do to further address these areas? So schools could design a comprehensive health curriculum. So schools could implement a well-rounded physical education curriculum that includes a variety of activities, which is not limited to only sports, but to exercises and to cater to different interests and different abilities of all students. Schools could also emphasize the skill development, teamwork, and the importance of regular physical activity in maintaining overall health. Also, what schools could do is organize regular health camps. Health camps at schools provide an opportunity to deliver comprehensive healthcare services and screenings to students in a convenient and an accessible setting. These camps aim to identify and address the health issues early, promote preventive care, and foster a culture of proactive health management. Another interesting area where schools could also implement is they could have fun health-oriented activities once in a while. So they could start something called as breaks, where they allocate dedicated time for recess and active breaks during the school day, which allows the students to engage in especially unstructured play, physical activities, and movement. Also, what schools could do is they could start walkathons, or they could start a program where the students ride to schools using a bicycle once in a week in a year, just to create awareness regarding the importance of physical activities. Mental health and emotional well-being. As I'm sure all are aware about this, but this is a grossly underrepresented area, or an area where a lot of us will not look deeply into. So mental health and emotional well-being plays an extremely important role in student health. So what can schools do in this area? So some schools may have counselors in place already. Many schools would not have. So what schools could do is initiate activities to foster the overall mental well-being. So school counseling services. So school counseling services play an extremely crucial role in identifying and addressing emotional and behavioral changes that students may face. These counselors provide a safe and confidential space for students to express their concerns. They offer their support, guidance, and may suggest even appropriate interventions to both the parents and the teachers. Schools could also start mental health awareness campaigns. So just to give you an example, you could probably start something like a Mindful Monday program or a Mindful Monday awareness campaigns, where students and staff engage in guided mindfulness exercise activities, breathing techniques, and reflective activities to reduce overall student stress and enhance mental clarity. Another awareness campaign that you could start would be Break the Stigma campaign, where students share their personal stories, create artworks, and participate in discussions to challenge stereotypes and encourage open conversations about overall mental health. Another important part here is what we notice: many students nowadays are extremely anxious or stressed. What schools could also address and implement is stress management and resilience building activities. So conduct resilience building workshops and programs that focus on developing coping skills and emotional resilience. These can include activities like group discussions, problem solving exercises, role playing scenarios to help students navigate these difficult challenges, build confidence, and bounce back from adversities. So we at Merago had a comprehensive webinar on the same topic last month, and the same video is available on our YouTube channel. Nutrition and healthy eating. It's an interesting topic, right? So what can schools do to address this area specifically? So schools could incorporate nutritional education into various subjects such as science, EVS, diet health, to provide students with essential knowledge about healthy eating habits, food groups, and the benefits of a well-balanced diet. Schools could also conduct interactive workshops and food demonstrations to enhance students' understanding and nutritional concepts and their practical skills. Schools could invite nutritional experts or clinical dietitians to share insights, lead cooking demonstrations, or facilitate taste testing sessions with the students So there is a participation. And schools could also implement healthy policies that encourage the availability of healthy snack options in school cafeterias. So this can involve replacing sugary drinks and processed foods like chips, biscuits with simple, nutritious alternatives like fresh fruits, yogurt, milk, fruit smoothies, and so on. So I've just collated the most common combination of foods that could sort of be introduced to a student to make their diet more comprehensive and more healthier. Just to give you a few examples, most commonly available food is maybe you could add a few eggs if they are non-vegetarians or if they prefer eggs. Another common thing which you could do is mix and match fruits and nuts. For example, banana with some almonds or banana with some peanuts, sometimes apple with berries or apple with almonds, or a guava with some carrots, or a cucumber with carrots, or sometimes even watermelon. If you have peanut butter, that's a good option as well. That contains good amount of protein. And classic yogurt with some fruit slices. These are interesting options where you can mix and match and probably improve the diet of a student. Coming to first aid and emergency preparedness. Ideally speaking, schools must have a well-trained nurse or teachers to deal with any medical issues that the students may face. I understand due to few constraints, this may not be the scenario in many schools. If this is the case, Merago can also offer to train or provide certified medical professionals to schools who can cater to the medical need of the students. So trained staff and school nurses, they can effectively administer first aid, they can manage chronic health conditions and follow proper protocols to ensure that the safety and the well-being of students is paramount. So I'm sure most schools would have a first aid kit ready, and importantly, quick access to it improves the healing and the overall recovery of the students quite a much. So quick access to essential medical supplies for prompt treatment and prevention of complications is extremely necessary. And it's also important to have collaboration between trained staff nurses, teachers, and other healthcare professionals, such as doctors or local healthcare workers, to provide coordinated care for students. Regular communication and partnership ensures that the students with specific health needs receive appropriate support, accommodations, and timely interventions. So just collated the list of the most essential first aid items which are required in a school setting. So they include your standard band-aids or bandages. They include instant cold packs in case of an injury or a swelling or a sprain, elastic bandages, thermometers, first aid manual, tape, and gloves. So these are some of the most important and the most common constituents of a first aid setup. Another interesting topic is vaccination programs and infectious disease preventions. The Indian Association of Pediatrics and the World Health Organization have designed and implemented an exhaustive vaccine regimen for kids. I'm sure most parents would have completed the vaccination schedule as organized by the government of India. So what's the importance of immunization? So immunization prevents the spread of vaccine preventable diseases and protects the health of students, staff, and overall school community. The role of immunization in maintaining herd immunity, as you're all aware, is extremely important, and it reduces the risk of outbreaks within the particular school environment. So what also schools could do is they could organize immunization campaigns once in a year or maybe even twice a year, depending on the various outbreaks in that particular season. For example, a H1N1 outbreak or a cholera or a typhoid outbreak. Schools can conduct immunization campaigns with collaboration of the local healthcare authorities. And coming to the third point, what are the preventive measures which schools could adopt to reduce the spread of infectious diseases? This is an extremely important topic here. So the schools could encourage the adoption of measures such as regular hand washing or hand hygiene practices, respiratory etiquette, routine cleaning and disinfection, and promoting a healthy environment that supports student health and well-being. just wanted to put across what are the most common things a school could do to improve or reduce the incidence of preventable diseases. So hand washing techniques, as you're all aware, is quite an important topic, which by students implementing, they can reduce the risk of having preventable diseases. So what the schools could do is have these posters put up across notice boards, across in restrooms, where the emphasis is on washing hands thoroughly with soap, covering your thumb area, covering the area between your fingers and between palm to palm, and as well as wrist. The images on the right promote good respiratory etiquette, maintaining good respiratory hygiene. So a common sight across schools is kids with a runny nose or kids sneezing and kids coughing. So it's quite common that these symptoms or the flu-like conditions, they can spread across to other students. What schools could also do is encourage the use of handkerchief, encourage the use of tissues to wipe the students' nose properly, to cover their mouth while sneezing or coughing, and to make sure that these tissues or handkerchiefs are disposed of in an appropriate manner. And also by ensuring these small practices, the incidence of illnesses of students especially can be brought down a lot. Health education and health promotion. So schools can implement a comprehensive health curriculum that covers a wide range of health topics, including physical health, mental health, nutrition, education, substance abuse prevention, especially in among late teenagers, and even personal hygiene. So what could schools do in this area? So they could organize awareness campaigns. So just to give you an example, you guys could organize a campaign called Healthy Habits is Healthy Mind. So a campaign promoting the importance of nutrition and regular physical activity, which involves workshops, fitness challenges, healthy recipe competitions, and so on. So inviting healthcare professionals or experts in their particular fields to provide guest lectures or workshops is also beneficial. Partnering with the local community organizations to offer extracurricular activities such as sports club, cooking classes that promotes healthy lifestyles is also possible. So another idea is to have student-led health clubs or committees where the students can decide the cafeteria menu, they can decide the topic to be discussed, and they could have a debate or a discussion on the same. And the awareness campaigns conducted by schools could also be targeted at such certain campaigns such as anti-obesity, anti-smoking, anti-drinking, informing the students of the ill effects of bad health, of tobacco, of alcohol, and of obesity. So these are the main take-home points which I would suggest is the key to the overall webinar today. Schools could promote a holistic approach to health by addressing their physical, mental, and emotional well-being of students. Emphasize the importance of comprehensive health education, access to quality healthcare resources, and the creation of a supportive and inclusive environment. Empower students and the school community with knowledge and skills to make informed decisions about their own health. Raise awareness about preventive measures, immunization, healthy habits, and the benefits of seeking timely medical attention. Foster collaboration and engage local healthcare providers. Thank you. Over to you, Dr. Uday.
Thank you, Dr. Amit. That was wonderful, very simple, and very informative. We didn't want to have the seminar which is medically orientated because it becomes a little difficult to comprehend. So I will open up the floor for answering questions which are posted on the chat window. Even now, feel free to key in your questions and we'll take it up one by one. All right, now we have a question here. It says that as a primary school teacher, I want to know how we could reduce the incidence of injuries in school. Dr. Amit?
Yeah. Thank you. That's quite a good question. So injuries in schools, mainly, which are common falls, loss of consciousness in assemblies, or a kid tripping over and falling, resulting in small aberrations or contusions, as we call them, is quite common. So the most important thing a school could do in this area is to have a proper and safe and secure school health setup. So small things such as cleaning the surfaces or cleaning the areas before and after the school hours, and addressing the main accident prone areas by putting up signs, or examples, having adult supervision during and after assembly or at the end of school hours, and making sure there is adequate spacing between the benches, or making sure there is adequate spacing between various other chairs or desks, results in the incidence of injuries becoming very low. And by ensuring that the assemblies happen on time for the proper duration, and by creating awareness that the students need to have a healthy breakfast, ensures that the incidence of such incidents reduces.
Okay, we have a very relevant question. I was very sure this question will crop up. The incidence of obesity in school. Mr. Ashutosh Sharma, he's asked that we notice more obese children in our school these days. What are the causes for this obesity and how they could solve this problem by the school level and at the parental level?
Yeah. Thank you for that important question. So we need to understand why childhood obesity is on the rise today, and it's a pandemic within itself. So what are the most common causes of childhood obesity? So the most common causes would be eating a calorie surplus state, or what we call eating a lot of processed foods, eating unhealthy foods, and secondarily, the lack of exercise. So especially in students or among children, it has to start from the parents. So some other common causes would be socioeconomic causes, where the access to quality foods is not available. And sometimes even an undiagnosed or underimportant cause is stress and anxiety among students, which leads to an increase in the amount of calories they consume, in the amount of unprocessed or unhealthy foods they consume as well. So since you all know this is a very sensitive topic, this has to be dealt with very safe hands with the parents. The idea should be here to sort of collaborate with the parents and not lecture them regarding this. I'm sure most parents would be aware of the situation, especially with respect to their child being obese or being on the healthier scale. The idea would be to create awareness among both the parents and the students, especially regarding the various health foods or the health groups, regarding the importance of what is a carbohydrate, what is a protein, what are food resources which are rich in complex carbs, simple carbs, or fats. And the idea is to reduce your calorie intake by probably reducing the overall sugar control or the sugar intake, along with regular exercise. Exercise can just be something like a small walk every evening. It can be running. It can be the promotion of any sports activities that which the child may enjoy doing. So these are some of the things which a teacher could do to address the same with a parent.
Maybe I will add something to this. Not all childhood obesity problems are associated with diet. A small percentage of childhood obesity can be because of certain endocrine disorders or certain metabolic issues. So, if a child is rigorously following whatever you have said, and in spite of that, the child is obese, it is worthwhile for them to go meet a pediatrician or endocrinologist, because they could have diabetes and other related problems in their adult life. So, this is another important area where schools can early detect these kind of problems, because any teacher who's been handling a student will obviously know if the child is really following good dietary principles, in spite of which is putting on weight. So this is a red flag for the teacher, and the teacher can immediately call the parent and say, look, in spite of having a very good diet program, the child seems to be obese. I would recommend that you see a pediatrician and take it further to rule out medical related issues. Okay, we had another question on the Q&A panel. I'd encourage everybody to ask questions on the chat panel. The Q&A panel question by Ms. Kavita was, children are very aggressive these days. They are hyper aggressive. Is there any way we can handle this, or why is it so?
Yeah, that's quite an important question. I understand that the students are more aggressive and restless these days. So the best method would be to approach initially a counselor first, try to understand the students or the kids' point of view, try to make sure and rule out whether there are any mental health issues, whether there are any areas which can be addressed regarding the root of the issue, and what is the reason for the student's aggression. So the most common causes would be maybe domestic issues at home, maybe bullying at school, maybe just lack of good performance in exams, or maybe not having good friendships along with other students. The root of the issue needs to be addressed, and a counselor is a good person where this could be approached to.
If you had participated in our previous webinar, we had addressed this issue. Basically, every school today, a good school, should have a counselor or one of the teachers who trained with basic counseling. So by having intelligently placed questions, the teacher can understand what is the cause for the aggression and then address the issue appropriately. Because today it's a very complicated world. We have the social media influences, we have peer pressure, we have TV, we have so many other things, and the child wants to do so many things at the same time, mimic all the so-called peers and cause problems for himself or herself and the community. Therefore, a good counseling is very important, and I would advise your school, if you don't have one, to seek help in how to attain good counseling skills by one or two of your teachers, and it will go a long way in solving these kind of problems, and your school could be a model school in this area. Moving on, there are a few more questions here. I will take it up. Names, Suchitra is asking a question. Names of government agencies that can help students on mental health problems, as they're too shy to share with the parents or the counselor. Similar, this question will have a similar answer in the sense that, yes, there are a lot of governmental agencies available, but what happens is no parent would be very happy to take a child to a governmental mental session for counseling, etc. So having an in-house counselor or having one of your teachers trained in counseling can solve most of your problems, and those which you can't solve may require actual medical help. I hope that answers that question. I'll come to the next question. What are the most common things that can be implemented immediately in schools to improve children's health? Amit?
Yeah. So that's quite an important question. So the most common things which could be implemented immediately at schools, number one would be to have a safe and healthy environment for the students to thrive in, especially ensuring that they avoid any nasty falls, injuries, or any other medical issues as such. The second thing which could be done is, like I showed you in my presentation, having good hand washing practices. So most common diseases nowadays are spread through touch, or they're spread through respiratory droplet infections. This is quite a good way to prevent further spread or even stop the spread of such diseases. Having good respiratory etiquette or respiratory hygiene, making sure that the students are aware of this, contributes a lot as well. So ensuring that the student or the child covers their nose or covers their face or mouth with a kerchief or a tissue before coughing or while sneezing, it's quite an important aspect as well.
Okay, thanks, Amit.
Yeah. So this is quite a good question and quite a common issue, right? Parents, maybe due to lack of awareness or due to paucity of time, end up sending processed foods which are readily available, readily accessible to their children. And often these processed foods are extremely tasty, which sorts of hooks on the students to these taste enhancers and these processed foods. So what maybe parents could do here, or even teachers, would be to make sure that the awareness is created, especially among parents. What are the ill effects of processed food? What is the importance of good, healthy food? And what is the importance of good, healthy food on the development of a child? And what they could do is they could lead from the front by making sure that the parents themselves follow these practices, because the kids always do what the parents see. Actions are louder than words, as I'm sure you're all aware. To make sure that the kids follow that, the parents need to follow this in the first place. They need to manage their schedules accordingly. And another thing which probably the parents or the teachers could do is they could advise the parents to have these healthy foods appeal more to the students or more to the kids. For example, maybe make it more colorful, make it more or in a pattern of their favorite cartoon or superhero. These are small things which the parents could do. Most important is the parents need to have that awareness. They need to read up and make sure that the food they are giving their kids are healthy and nutritious.
If all the children start bringing in healthy diet, then the student tend to sort of mimic each other and tend to copy. All right. So, but in any case, it's a difficult problem, but then you have to do it because the school's health is at stake. Let's move on. There's a medical question here. Ms. Rashmi asked this question: how do we handle students who faint during assemblies? That is a medical question and is very commonly seen. I think girls have it more often than boys. A few things I want to highlight here is, first of all, when the child falls, don't try to scramble and then make her sit up. The best way to recover from somebody who faints is to allow that child to lie down. In a matter of 2 or 3 minutes, the child will automatically get up. Don't try to pour bucket full of waters on the patient's, on the child's face. The child might choke and drown. All you have to do is make sure there is enough ventilation. Gently try to talk to the child. And believe it or not, in 3 or 4 minutes, the child will get up. It's basically because they may not had breakfast, or if it is a girl student in the early teens or the late teens, it may be menstrual issue. It could be so many things. The child may be having anemia. Subsequently, a doctor can have a look at it and try to find out what it is. But basically, give it time, make the child to lie flat for about 2 or 3 minutes. The child will wake up 9 out of 10 times. Okay, let me go to the next question. This is once again a medical question by Mr. Gopal. He says, what is the main cause of abdominal pain in students? Because children report a whole lot of abdominal pain in schools. Amit?
So the most common cause, as you are all aware, is what we call hyperacidity or acidity issues, mainly due to having untimely food, or mainly due to having spicy food or more of processed food, which leads to this pain in abdomen cases. And like Dr. Uday mentioned, another common cause is girls in their early teens or late teens. That's quite a common scenario for having abdominal pain. And coming to the next point, how to address this as well, right? So again, this all comes back to having a good diet, having food on time, making sure that you are drinking 2 to 3 liters of water daily, making sure that the kid is getting adequate sleep. These are some of the small things which you could do to reduce the incidences of abdominal pain.
Okay, another question, Ms. Suchitra Malviya. Are there any private agencies which can provide online counseling to the students? Yes, ma'am. There are a whole lot of agencies available today, and I take pride in the fact that at Merago, we have done a lot of counseling for both schools as an organization and for individual students. You can log on to Merago, and then our expert counselors will talk to the students. We've been very good at it. In fact, just recently, we conducted a massive program for school and college children about mental health. and we have experienced staff who can handle this. There are similar organizations all over, so there are plenty of help available. And the best thing for you to do is to log on to any of these agencies, including Merago, and seek help. Okay, now let me move on to another question. This is to do with modern day problems our children face. The use of electronic gadgets are adversely affecting the physical and mental health of children these days. How do parents and teacher handle this? Now, I was in a restaurant last week. There was a family of 4, and they wanted to have a discussion. And there were 2 children whom they had brought along. And the children were creating a noise because they were not be able to sort of contained in a physical space. So the mother very generously takes out her smartphone and gives it to the child. The child immediately goes into a corner, opens up some game, I think Candy Crush or something, and lo and behold, everybody is happy. But I don't think in the long run this is a happy situation. The electronic gadgets are not something which you do to quieten a child. You in fact harming a child. Amit, would you like to add to this?
Yeah, I completely agree with you, Dr. Uday. And another thing which schools or even I think most schools already do this, they do not allow for a mobile phone within the campus, and especially so schools make sure that cell phones are not carried within the premises. And what also parents could do is they could have mandated screen times. So maybe half an hour or 1 hour or 45 minutes of screen time and not beyond that. So that sort of sets an understanding and an agreement between both the parent and the child.
Yeah. This is a very interesting question, Amit. I'm sure you'll be able to answer this. See, we all talk about what we should do to the students, how we should train them, etc. But somebody has asked the question here, Sharda Pillai. Yes, what she has said is, see, students are very sensitive. Beyond a point, you can't push them because they tend to sort of take you otherwise. How do we handle this? How do we identify issues that the student may not express, or how do we preempt actions that arises of a feeling of being neglected? Now, these are very sensitive, especially there are some students in a class who are very quiet, who feel that they are not heard. We need to identify them and address their issues. How do you handle this situation?
So this is a very important question. So what I would suggest is look at the behavioral changes in the child. For example, if a child is very quiet and you notice that there's a change of behavior where the child becomes very loud, or if there are huge gaps in their behavioral changes, that is a sign. And somebody, for example, who is a child who is very active, who is very participative, and if you notice that there's a change in their behavior leading to less participation or overall academic performance or even the sports performance has reduced, these are some of the signals, or these are some of the actions which needs to be looked at and looked further at. And another thing which I would suggest is always try to have a clean and a clear communication with the students to ensure that whatever they share, or at least in the school, it's a safe place for them, where the main idea is for the child to thrive. And if they want to share any sort of issue with you or with the teacher or with the parents, and that's a definite thing which they can do. The children are more afraid about the consequences rather than the action itself. And sometimes it takes a lot to notice a behavioral change, or rather a change or a dip in the academic performance, and certain things like this. So, yeah.
Right at the beginning, Sharda had mentioned that a certain amount of sensitization is required. A badly trained teacher or a untrained teacher can ruin things in a sensitive child. The students look up to teachers as role models. So if a teacher is orientated, sensitive about the child's problem, they can have a one-to-one session or have a bunch of similar students and have a group session. And then you will be surprised, they open up, they share all their problems, and the teacher has been trained as to how to handle questions. You shouldn't ask leading questions. You should listen to them, understand where they're coming from. That itself solves half the problems. Therefore, it is imperative for all the schools to understand the role of counseling. Now, it may sound very superficial, just listening to a student, but there is something called active listening, by which you empathize with the student, you understand what the student is saying, and the student feels that there is a very silent reciprocation between the teacher and the student. It's a little difficult, requires a little bit of training. Merago will be very happy to offer this kind of training to any of the schools which come forward. This is the way the future is. The children are subjected to an onslaught of various external problems, and it is up to the schools and to the teachers to at least nullify some of these actions and make sure that the child doesn't become worse. Okay, let me move on to the next question. What is it? Okay. Okay, there is a wave of conjunctivitis in the country today. In fact, we've been getting a lot of calls about this. Dr. Amit, would you like to say something about conjunctivitis, how it spreads, and what one could do to handle this?
Yeah. So seasonal conjunctivitis, or what we call bacterial or viral conjunctivitis, is quite literally in the words viral right now. Yeah. So the most common cause is either bacterial or viral, and it's most commonly seen in monsoon or early winter. Some of the things which you could do to prevent or address is follow the basics. Make sure that you don't rub your eyes. Make sure you wash your hands with soap regularly. And let's say somebody in and around you is diagnosed with conjunctivitis, make sure you put across this info to them as well. For most conjunctivitis cases, antibiotics are not necessary. In case of discharge or pain or swelling, we start them on antibiotics. Other things which you could do is you could reduce screen time and make sure that you avoid wearing makeup on your eyes. Make sure that you don't rub your eyes quite often, and you wear protective eyewear when you go out. So these sort of small things can ensure that you prevent conjunctivitis, and even in case that you have contracted conjunctivitis, it is an easily treatable condition, nothing to worry. Yeah. Group activities, which maybe most of the group can partake in, maybe small sports activities or even academic activities help. I do not have details of special children and what type of special children they are. To particularly give you one or two examples would be difficult at this point of time. So please feel free to email us or contact us. Our details are available, and I'll get back to you with a proper answer.
Kavita, see, special children can be either slow learners, people with specific learning disability, with maybe borderline autism, etc. So these children have to be handled with care, because misguided therapy or branding them as dullards and things like that can make matters worse. In fact, I believe these children perform better academically than the normal children, because they have abilities to special abilities to learn, but they will have challenges in learning languages and learning mathematics, because they are special areas where these children are slow to pick up. On the other hand, they're very good at drawing, at sketching and things like that. Identify that, talk to the parents, and there are enough organizations today which will help them to grow. All right. And in fact, in very bad cases, today the government of India and any state government has exemption for these kind of students, once they're certified by a medical agency, not to take mathematics and language as a subject. That is part of the government of India rule today. So in really bad situations, to help these kind of children, the curriculum can avoid mathematics and avoid language. So you please speak to your local agencies, find out what you can do, but these special children have to be handled with care, because they are indeed very, very special for me. Okay, now, are there any more questions? Okay, there is one question by Suchitra. She says, it's a long question. Why students want to skip their schools and would like to join coaching classes even after providing all facilities and good learning platforms in the school? The added question here is also they feel hesitant to answer questions in front of a class or an assembly. the teachers are unable to solve their problems? Any advice?
I mean, this is quite an interesting question, right? I mean, the reality is that sort of these days, entrance exams or even board exams have become sort of a rat race, where one student wants to be ahead of the other. The most common ways they do is they get into coaching classes way earlier before the boards or before the entrance exams to make sure that they have a head start. And what happens is, if 10 students join, due to peer pressure and due to other issues, the other 10 or 20 or 30 students in the class join as well. And what happens is, these tuitions are targeted at exclusively passing the exam with flying colors. They are not worried about rest of the overall development which a school takes care of. This is overall a societal issue, I guess. I mean, this is a huge discussion in itself. Would be interesting to have it some other day.
Okay, now to answer the second part of your question, the child feels hesitant to answer questions in front of the assembly. The teacher is unable to solve their problem. Now, this is very typical of a child with low esteem. What happens is, previously when the child had tried to speak, people may have laughed at the child, or the teacher may have reprimanded the child because the answer was not appropriate. All this make the child hesitate to speak. By itself, in the default mode, every child is enthusiastic, would like to be on the stage and talk. The moment the child doesn't do that, there is an antecedent to this particular problem. So when you handle children and ask them to participate, ensure that they're not ridiculed, even if they make a stupid reply. You say that everybody makes mistakes. The second time, maybe she's better. Second thing, what you could do perhaps is have role play. If I do a lot of teaching, and if I were to get students to participate in my program, I would role play. I will take one of the students and say, you are my teacher. Now I am a student. Okay, I'm asking a question. And what would be your response to my question? Immediately the student realizes that everybody makes mistakes and it's fun, and disregard the ridicule and go ahead and do what you want and award the child. If the child answers good or bad, award the child. That encourages the child, and make sure that everybody participates in a program. It is a little tricky. Once again, I told you, you require a little bit of skill in counseling, but I think all teachers, basically, even before attending a counseling course, are about 25% good counselors by sheer experience. You need to fine tune your skill. Put yourself in the child's shoes, take the whole class along with you. Believe me, you will be the most popular teacher in the school. All right. It requires a little bit of skill, and I'm sure all of you are capable of it. All right. So I believe we have come to the end of all the questions. This has been a fantastic learning for me, more than for you, because the kind of questions which have come in have really opened a whole lot of thoughts in my mind. Please handle the children like we mentioned. Do your best, contribute to your school's education, your own growth, and to the nation's growth. And then feel free to contact us if you have any such questions, and a one-to-one on mail, or if in any of your children require counseling, please contact us. We have counselors to help you. We are basically here to help you and then get your school come out with flying colors. Okay, so here we will we'll close the question session here. I have a few points to make. I want to thank Dr. Amit for the informative talk. And then I want to thank all the participants for this wonderful interaction and participation. We'll be conducting similar webinars at Merago and programs to promote school health and wellness in the future also. Please watch out for our notifications in your emails and on social media. We will keep you informed as to how we are going ahead with the future programs. Also, all the registered participants will receive participation certificates in the next few days. Please check your email notifications for instructions as to how to download them. And with this, I think we'll come to the close of the webinar. Dr. Amit and myself, Dr. Uday Kumar, wish all of you a very great day and convey our best wishes to you, your school, and all your wonderful students. Thank you very much. Ladies and gentlemen, it was a lovely audience you are. Thank you.
Thank you all. Thank you for your participation. Have a good day.